So for this last video, we're going to talk about what is our strategy going forward. How do we come out of this, and how do we prevent from having a huge spike in the future? A lot of people are saying, well, I'm glad that we're succeeding with the social distancing, we're flattening the curve, we're seeing all these things drop, but what happens when we start going back to work and going back out in society? So what this has done with the social distancing and isolation is we have dropped the number of cases that we're seeing. And a lot of us are seeing the peak happening, and we're going down the other side. And at some point, we're going to be going back to work, going back to our lives. And people are right. When we do that, we are going to see a bump again in these cases. But there's two things that have been developed since the beginning of this crisis. One is we have very rapid testing. In the past, it took us 7 days to get testing. So testing was limited, and we didn't know who had it and who didn't. So everybody had to go into isolation. Now we have testing that can be done in 5 minutes or less. So when you go into the doctor's office now and they're suspicious you have this, you can get tested. And if you're negative, you have something else and you can go back to work and go back to your life. But let's say you're positive. Now we know you're positive and you go into quarantine for 14 days, as well as communicating with your doctor in case your symptoms get worse. But most importantly, we can do what's called test and trace. We can now test you and trace everybody that you've been in contact with and everybody that you're close to. We know with this crisis that it's very common for small circles of individuals in tight-knit areas to cause a lot of rapid spreading. So we see this in New Orleans with Mardi Gras. We saw this in Sun Valley with a weekend of skiers that all came and gave it to each other. And we see this throughout the country, that it seems to be a small amount of people that get in the tight congregation and then spread it amongst themselves. So now we can test and trace everybody you've been in contact. And if we can isolate those people quickly and put them into quarantine, then they're not going to go out there and be infecting everybody else. And this is what Germany has done, and this is what South Korea has done, and this is why they've been so successful. So we can do that now. The second thing we have is antibody testing. We can now tell if you've been exposed and you have antibodies. And this is essentially better than a vaccine. So if you have antibodies, the likelihood of you getting sick and dying are very, very low. And now you can go back to work. You can go back to being a healthcare provider, and the chances of you getting sick are slim to none. In fact, we're finding that you can take the plasma from these patients, spin it down, and give it to patients in the ICU, and dramatically reverse the course that they're going south quickly. So that's very positive. And that's widespread as well. I got my antibodies tested last week. Unfortunately, it was negative, so I haven't gotten this virus yet. But unfortunately, I kind of wish I had, so I had the immunity. But at least I know, and other healthcare workers will know. So those are the two big advances that we have. And then lastly, we're figuring out all kinds of things to tip the curve, which is what we talked about in our last video. The supplementation with vitamin C, zinc, quercetin, magnesium, and all the things we talked about. And if all of us can get on that regimen and stay as healthy as we can, identify who's infected and quickly identify who's been spread to, we can keep this thing down long term. And then hopefully when a vaccine comes out, we've got that to add to the arsenal as well. The reality is this disease is really killing those people with immunocompromised systems. So it is affecting the elderly, it is affecting people with diabetes, high blood pressure, asthma, and heart disease. So there are exceptions to the rule, but by and large, that's who's being affected the worst. So if you are not one of those people, and you can take those supplements, and you can quickly identify when you've been affected, the odds of you doing well are much higher than otherwise. Hope this was helpful. We're going to add information as things go, but we're always looking to educate you, to empower you to make the best decisions for your healthcare.